Hi, my name is Ryan Ock, and for my gait analysis, I chose to look at overground treadmill walking at 3 speed and compare that to underwater treadmill walking at 3 speed. Prior approval was given by Dr. Thorson for a different view to be used for the underwater treadmill close-up as seen as this. So regarding methods for observing TM's gait, in both overground and underwater treadmills, the use of our facilities treadmill, underwater treadmill, and an iPhone were used to capture data. Both setups were identical, with the treadmill's speed gradually increased to 3 speed. Once that speed was reached, TM walked for about 2 minutes before video was taken to avoid any errors that could be present in his gait right as the speed was increased. This allowed for a consistent gait that was established before the video was taken from both planes of view, both full body and close-up of the knee down. Videos were taken to be able to analyze the full body movement as well as any differences among the lower half. The reasoning behind the close-ups is that in water, up to 50 to 60% of your body weight is supported and creates less force on joints, which can in turn alter stride length and timing as well as joint motion kinematics, according to So and his colleagues. So working down the body in analysis, the head shows no significant movement or tilting throughout and maintains fairly neutral. There's a clear reciprocal arm swing with a steady rhythm between opposite arm and opposite leg. Slight rotation of the trunk through the transverse plane was seen, but nothing major as the trunk holds a solid base for the limbs to move around. There's a slight forward lean present during gait, but it's probably due to the need to maintain momentum at the constant speed of the treadmill. The pelvis upholds normal forward rotation with the stance side, while the hips move smoothly from a flexed position at contact and into a full extension during terminal stance. The hips move fluidly throughout and bring the limbs through efficiently without causing any problems. Knee movement is also smooth and moves through gait without any problems or hesitations. It also appears stable and there's no visual evidence of any excessive hyperextension or similar problems. During swing, the knee also has sufficient flexion during mid-swing, allowing for the foot to clear the treadmill belt fairly easily. Initial contact with the belt is clearly heel strike driven, does not show evidence of a flat or forefoot strike. The movement's also a smooth, quiet strike on the belt with no significant slapping or stomping to propel the body. And there's also active dorsiflexion during swing phase, which allows for the toes to clear the belt easily. Moving on to the frontal plane of overground, the head remains centered throughout the gait cycle with no tilt or rotation present. The trunk is also well aligned, but there's a very slight lateral shift over the stance limb to maintain center of mass. Shoulders are fairly neutral and even slightly protracted, but there's no visual evidence of shrugging or asymmetry. Elbows are maintained at a relaxed but slightly flexed position for a natural arm swing. There's a slight pelvic tilt down on the swinging limb side, indicating that hip adductors are working properly to stabilize the pelvis. There's no excessive hip abduction or adduction, as the limbs stay relatively parallel to the midline and no excessive movement is present. Hips also appear stable during loading and provide a strong lever for propulsion during push-off. The limbs also follow a straight path with no evidence of excessive IR or ER of the leg. Knees maintain good alignment with no collapse during loading, and the patellae remain properly oriented forward, indicating proper movement. Ankle and foot appear stable while weight bearing with no medial or lateral wobbling, and there is slight pronation of the foot during loading to absorb force, but not enough to be excessive. And stance width is narrow, but not to a point where it causes any gait problems. Moving on to the underwater treadmill. The head's neutral while walking with a slight upward tilt that can be attributed to TM watching the underwater cameras ahead of him. Arms are held slightly wider when underwater as well as slower, and can be due to the need for stability and acting as sort of paddles against the water. Trunk rotation is more minimized underwater as the torso is more rigid and engaged to stabilize against the moving water. It's also much more vertical underwater, which can be attributed to the need to maximize buoyancy and maintain a stable base. Pelvis continues to rotate with swinging and stance sides, but is slower due to water resistance. And hip extension is also less pronounced underwater because The water is providing an upward lift and reduces the need for a powerful push-off compared to overground. It's also emphasized high knee or higher knee hip flexion action, which could be the result of the buoyancy aiding in the lifting of the limb. Knee movement is smooth, with the water creating a constant resistance that smooths out the flexion to extension transitions. Stability is still strong, even with the reduced weight bearing the pool provides. Knee flexion is prominent during swing phase, and water aids in the ease for the foot to clear the belt. Initial foot contact is more of a flat foot to slight heel strike, which is caused by the buoyancy slowing the descent of the limb and making the transition more subtle than overground. It's also quieter, with water lessening the impact of the foot, and neutral dorsiflexion is maintained with a slight trailing effect of the foot due to water drag. Frontal plane now. The head's extremely stable even with the moving water. Trunk's very stable and centered, indicating strong core. Shoulders are more neutral and stabilized compared to overground, acting as a counterbalance. Elbows maintain a flexed position and they're held slightly further from the body to handle the water resistance. Pelvis drops are very minimal, with the water assisting in more level pelvis and making swing phase side easier. No displacement is seen, with the buoyancy smoothing out any bounce in the gait. Leg path remains straight and hip shows no sign of giving way during loading phase, indicating good stability all around. Limbs are traveling a straight path with no excessive deviation seen. Knees stay properly tracked over the toes, and patellar orientations forward and consistent. Both the foot and ankle appear stable at strike, and alignment's neutral with the foot, with a slight pronation present at mid-stance as the foot comes to the belt. Stance width is slightly wider than overground, which is probably for increased balance in the water, and toe alignment's symmetrical as overground was. And yeah. Looking at a side-by-side of the two gait conditions, TM's gait shifts from a momentum-driven overground pattern to a buoyancy-assisted aquatic pattern. Overground, there's more of a forward trunk lean and high-impact heel strike, whereas underwater focuses on a more vertical posture. This aligns with Ragu and colleagues' findings that the trunk is more vertical in water, reducing the need to lean forward to counteract gravity. Kinematically, TM displays a high knee swing to combat drag, which is in response to the interaction between hydrodynamic resistance and buoyancy, according to So and colleagues. TM appears more stable in pool compared to overground because EMG amplitude is found to be significantly lower in water for most muscles during the stance phase, with the water acting as a supportive sleeve and allows the individual to maintain frontal plane stability with less muscular effort than on overground, according to Barea and colleagues. TM's gait patterns are determined and defined by the influence of environmental forces and mechanical adaptations. So in terms of linear kinematics, velocity and displacement differ due to resistance present underwater. Overground, a linear velocity of 3 speed with a forward-leaning trunk was present to maintain position, where underwater displayed a more vertical trunk and slower linear progression due to the drag of water present. This trunk shift influences angular joint kinematics directly. Overground, hip and knee followed a standard reciprocal arc, whereas underwater there was higher peak flexion at the hip and a high knee gait, which altered the angular velocity of the swing phase. This can be attributed to how underwater treadmill increases hydrodynamic resistance to influence gait movement as well as buoyancy on the body, according to So and colleagues. Regarding linear kinetics, ground reaction force was high at initial contact on overground, displaying a strong heel strike. Underwater, a softer flat foot contact was present with the buoyancy, providing an upward linear force to offload the joints. This changed the angular joint kinematics directly also. So overground, high internal moments / torques from the plantar flexors and extensors propelled the body against gravity. Underwater, the angular moments / torques required for stability was reduced in the pool due to buoyancy, which allows the body to maintain a stable plane with less muscular torque, according to Barea and colleagues. And here's my references that I used. That's it. Thank you.